Thread lifts. What is a thread lift? There are several different types of thread lift. We're talking about, on the simplest level, PDO thread lifts, which involve polydioxane threads being inserted into the face. Sometimes this can involve very fine threads just inserted into the skin to generate some collagen production. And other times they involve longer threads with these little barbs attached called cogs, which are inserted into the deeper layers in an attempt to lift the SMAS or the deeper layers of the face. Then we have other tissue repositioning sutures like Silhouette Soft, which are made of polyl-lactic acid and contain these little cones along the length. These again are resorbable sutures that provide some tissue repositioning and collagen stimulation. Whereas the PDO sutures may dissolve over a period of about 6 months, the Silhouette Soft polyl-lactic acid often last a bit longer, maybe around a year. You then also have permanent threads, which never dissolve, which stay in the face, even though the result of them will also never be permanent. So thread lifts can mean many different things. The one thing I would say is, from auditing of data by the British College of Aesthetic Medicine, which correlates very well with what I see in my own practice, thread lifts are associated with the most complications of any non-surgical procedure that we do. So they are a higher risk procedure. You're inserting these threads into layers of the face that you cannot directly visualize. We have some very delicate structures in there, including nerves, blood vessels. And I remember having been shown pictures by a good plastic surgeon friend of mine, Mr. Mark Pacifico, of threads he'd found during a facelift, where these were permanent threads and it was literally sitting a millimetre from the facial nerve. And that could have been a catastrophic injury if it had been just a millimetre difference. So it's really important to take these procedures seriously. They come with risks, be that infection, nerve damage, bleeding, bruising, many different possible risks. Do I think they're worth it? It's a hard question to ask, because I think in the right person, they really can be. So when someone has the right amount of volume in their face, but they still have this sort of drop of the tissue, some threads can really help. But I think they should be in the hands of people who do them a lot, which is why I don't personally do them. I find they were such a minor part of my practice that how can I truly be an expert at them when I'm not doing them that often? So when I find a patient in my practice who I think is a perfect candidate for threads, I would much prefer to refer them on to a colleague who does a lot of thread lifts, for whom this is a mainstay of their practice. They will also in turn have more experience of dealing with the complications. And what is important is to minimize those risks, but also to be prepared to fix the possible problems if it does go wrong. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.